my name is Dora Valencia, and I'm happy to be representing a Latin American country in this CEAS cohort. So this summer, I worked with the National Cancer Institute of Argentina, which is located in Buenos Aires, Argentina. And I have titled my summer 2018 project, Summer I say that in quotes because I lived the coldest winter of my life this summer. And yes, so I titled Participation with the National Cancer Institute of Argentina, the T1 Research Project, and the creation of a virtual training module for T1 surveyors. Oh, also, I'm a student at the University of Arizona, and my concentration is Family and Child Health, Global Health track. Okay, so a little bit of background on breast cancer, specifically in Argentina. So Argentina has the highest mortality rate of breast cancer, the second highest, in South America. And they have an incidence of about 19.9 in 100,000, which equates to about 6,600 deaths per year from this disease. Now, Argentina, they have an established universal healthcare system that has been around for over 60 years. And through this universal healthcare system, people have the availability of all services free. So this includes screening, diagnosis, and even breast cancer treatment after. So through this universal healthcare system, they are allowed clinical exams and screening through mammography biannually for all women of 50 to 69 years. And this is just like the general numbers that they have, but if they're women that are at higher risk, they are also allowed to have these services. Now, despite the availability of these services, about 30% of breast cancers in Argentina are diagnosed at advanced stages. Now, this is a problem because we know that breast cancer is a highly curable disease if it's diagnosed in early stages. Now, when diagnosed at late stages, there's a lower survival rate and more aggressive treatment plans and surgeries that women undergo. So now, continued background information. So I joined what I call the breast cancer team of the National Cancer Institute of Argentina. In long, their name is actually Plan for National Prevention and Control of Breast Cancer in Argentina. And their objective, their main goal, is to reduce breast cancer mortality and breast cancer incidence in the country of Argentina. They do this through three core functions, which are quality control, monitoring, and coverage. And this is done by different activities. So for example, they provide information to the general public, they offer data registry trainings and services, they do audits of equipment quality control, and also, on occasion, they perform investigational research for implementation, which is my case that I joined. So I joined an already established study, so this isn't my study going in. I was actually invited to collaborate with them on this study that they were actually already planning to move ahead with. So this is the T1 survey study, and it is a follow-up to two previous studies that were also conducted in Argentina. So introduction, how did the T1 survey study come to be? So the first study took place in Santa Fe province of Argentina, and it focused on the delays and barriers that were present from the first contact that women had with the public healthcare system to those faced throughout their diagnosis and their treatment. The analysis of women's trajectories as they navigated the healthcare system were divided into four different time frames. So this is time 1, time 2, time 3, and time 4, which are denoted as T1, T2, T3, and T4. So T1 specifically focuses on the time from when women notice their first signs and symptoms to when they first receive their first medical consult within the public healthcare system. Now, time 2 focuses on their time of mammography or other screening method to their diagnosis and so on. Now, these timeframes were defined using the information that is called the beginnings of CITAM. Now, CITAM is NCI Screening Data Registry System. So they created this entire platform database that they've now disseminated throughout the country of Argentina. And they're doing a pretty good job of implementing this data registry throughout all public healthcare hospitals of the country of Argentina. There are still some provinces that are iffy on using this system because they have their own, and since each province has the right to make their own decisions in these type of situations, then there's some pushback there, but that's the rare case, and they're still pushing towards getting CITAM in there as well. So now, the results from this study, the participants were found to experience barriers at the interpersonal level, and institutional level. So now that encompasses all levels, and so there was just too many barriers that they were facing. Another result was that women experienced delays specifically during breast cancer services and treatments. Now, an important observation that was made during this study was that time 1 could not be characterized using the information that was available in CITAM because it fell out of the parameters that CITAM covered. So it was decided that it was necessary to develop a tool that could specifically characterize time 1 or T1. So now in response to that, the T1 survey was developed as a data collection tool that could characterize the timeframes and experiences that are seen during time 1. The second study utilized this tool to question women about their motive for their first medical consult, the location of their consult, their healthcare coverage, and the time frame from their first symptom to their first medical appointment. Now, the results that were found were that women did not seek care until a symptom arose, despite the availability of biannual screening. They experienced delays of over a month in obtaining a medical consult, and that participants with only public medical coverage often sought care in private clinics. Now, what I mean by public medical coverage is that these were the people that only had the general coverage that is available to everyone in the country, nationals or foreigners, everyone. Now, there's other people that have other programs that are made available to them by their employers or through the military or through the government, such like that. But these people only had the general coverage. So the overall conclusion from these two studies was that the T1 survey study should be expanded to further describe the barriers and delays faced by women when accessing breast cancer healthcare during the T1 timeframe. So this is where the T1 survey study comes into play. This is the expanded study that is currently taking place in the year of 2018. This is a cross-sectional retrospective study, and the survey is specifically formatted to be able to collect quantitative and qualitative data of the experience faced by women from their first signs and symptoms of breast cancer to their first medical consult within the public healthcare system, which we now know is denoted as time 1 or T1. So all participants in this study will be women that are diagnosed with breast cancer from January 1st of 2016 to December 31st of 2017. Now, utilizing CITAM, all the women that fit this criteria have already been identified, and that equals now 375 cases. Now, participation in this study is completely voluntary, so the final population of the study will be determined at the end of surveying. Now, and the women are also receiving breast cancer treatment in one of the 5 hospitals that have been selected for the study. These hospitals are located in the provinces of Mendoza, Santa Fe, and Buenos Aires province. The survey will be implemented by data registers of the NCI that work at these hospitals. Now, data registers are employees of the National Cancer Institute, and they do exactly as their name denotes. They take the information from the medical records and information from screening, from diagnoses, from treatment, and they turn that from the paper version and they put all that information into the online system, which is CITAM. I was lucky enough to be able to shadow a few of them during their rounds, and they do so much more than just enter information. And I could go as far as saying that some of them act as patient navigators because they go ahead and guide people throughout the entire complex process. So currently, the study's protocol is under review by all provincial and hospital IRBs. So something that I learned while being in Argentina is that Argentina has a very strict data collection and personal data protection laws. So this requires that all studies have IRB approval at the provincial and hospital level. So since this is taking place in 3 provinces and at 5 hospitals, that totals 8 different IRBs that must approve this study in order for it to move forward. But it's in the works, and it will happen. They're hoping that we'll to receive all that by September. And surveying and data collection will commence once all approvals are received. So in preparation for data collection, I did not pack up my things and went home. I stayed and I created a training module for T1 surveyors. So this training module was made to prepare surveyors to implement their surveys into their respective hospitals. So this training module focused around basic research methodology, surveying methodology, and surveying best practices. I created this through extensive research throughout the literature. I expanded it to be in Spanish, English, and French, and that's how I created the training module. The objectives that I made for this training module were to enable surveyors to complete the training module on their own time and allow them access to information whenever they may need. To offer easy to understand, succinct information to ensure retention of the information, and to improve survey implementation by training surveyors with research and surveying best practices. This training module is available through the National Cancer Institute's virtual campus, which they use for other trainings, throughout for their employees and other hospital employees, and even for the general public. So this is what the virtual campus looks like. And this is what it looks like after I've logged in. And if you click on that blue bar, it takes you into the training module. And off to the side, you're able to open a forum that participants are able to use to discuss the training module in real time and get any questions answered that they may have. So now, feedback from the surveyors. Before I left, I was able to receive feedback from surveyor number 1 who took the training module. And since that time, I was able to receive feedback from another one, but that was after I turned in my presentation. So I have information from surveyor 1. So they experienced no difficulty with the training module. They already had some understanding of surveying best practices due to their past job experience. And during their first run-through of the T1 survey, they showed great understanding of how to successfully implement a survey and understand the layout of the survey after only one run-through. Now, surveyor number 2 had very similar results. They all scored 100s in the little quiz that I created for my training, and it was great. I have been able to meet with them virtually, and I will continue to do so with the other surveyors. And after all IRB approvals are received, there will be an online group training that will take place between Arizona and Argentina, and we will all be participating. There will be role play, and we will practice survey implementation and different scenarios they might be facing. So proposed future analysis. So I just got word from my mentors in Arizona that there's now an official partnership between the University of Arizona and the National Cancer Institute of Argentina so that I can continue working on this project, continue into data analysis once we have all that collected. So they will be doing their own, I will receive all data through an Excel database, and they will be doing their own data analysis through R, and I will be utilizing Stata. Now, the National Cancer Institute of Argentina, this is the physical space. So like I said, it's located in the capital of Argentina, so in Buenos Aires. It's a very large building. It was actually a very beautiful space. Here's the office that I worked in, and this is where the rest of the breast cancer team collaborates. This is reception. Here we have some of the posters that they've created throughout the years and that they've disseminated to the community, and now they have them displayed in the office. And they also have art campaigns that have also been displayed throughout Argentina and now are displayed in the institute. Now the people. So this is newly appointed NCI director, Dr. Julia Ismael. She just became director this past month, but she has been working for the National Cancer Institute for about 6 years now. These are who I worked with the closest. So on my right here is Dr. Veronica Pese, and she is an oncologist, and she serves as the director of the breast cancer program of the National Cancer Institute. This is Paula Granda, and she is who I call my main mentor because I worked with her every single day, and she was my go-to person for any questions that I had. And on the side are Cecilia and Nadia, and they are part of the breast cancer team. Now this is the entire breast cancer team, and I loved it because it's made up of many different specialties. So if I go down the line, I go epidemiologist, statistician, anthropologist, sociologist, and psychologist. Now, my learning experience. So I divided this into 4 different categories: research, surveying, national program, and culture. The most important points in research were I learned the importance of a mixed method study. I learned about the strict data laws of Argentina and how to properly handle a study's protocol. So this is my first research experience, and I did not know the intense care that goes into protecting a study's protocol. So that was a good life lesson. In surveying, I learned about the importance of survey design and how proper training and proper survey design can increase the success of survey implementation once it actually happens. Working within a national program was very interesting because I got to work with many different entities, including the universal healthcare system of Argentina. It encompassed multi-sectoral work, as you have seen from the previous picture, of all the different people and all the different specialties that they have. And the importance of culture also in research. So for example, why the Team 1 timeframe is relevant in Argentina, whereas it might not be important in another country. And I also always found myself comparing Argentinian culture versus Mexican culture versus United States culture. Ideas from this project for future students. So ideally, we'd be able to utilize the results from the T1 survey for, as they call it, investigational research for implementation. So we'd be able to create some change in the public healthcare system. So I propose using the results to create some sort of communication strategy that specifically targets women before time 1, specifically those women that are at risk of facing barriers and delays during this time frame. Also, I proposed expanding the survey to look at more rural communities, and as I thought about it, I realized that this would need further expansion of the survey. For example, maybe instead of the survey being at hospitals, they could be conducted at home, and this could include more in-depth interviews and in relation to this, we could look at other factors such as more socioeconomic factors and household characteristics. Research cites strengths and limitations. So strength, I found many. It was a structured work environment. There was many learning opportunities. There was an opportunity to learn about a national program. Everyone was very professional and knowledgeable. It was investigational research that is actually being used for implementation into the real world. And there was great, dedicated, and caring mentorship. Now, limitations. For someone who might be trying to come in and conducting their own research, they would probably experience many barriers due to the strict Argentinian data protection laws. And I also think that Spanish speakers might receive a more well-rounded experience than non-Spanish speakers in this case. Future career goals. So, along with my degree in public health, I am also pursuing a master's in French and Francophone studies. I have been pursuing French for 9 years now. So at some point, I would love to work with IARC, specifically with their early detection and prevention branch. I would like to pursue a PhD program in EPI, probably at the University of Arizona because I love it. And it's close to home. And at some point, I would love to work in Latin America and the Francophone-speaking countries of Africa. Now, acknowledgements. A special thanks to my Arizona mentors, Dr. Irma Ramos and Dr. Jorge Gomez, who gave me the opportunity, introduced me to the people in Argentina, and allowed me to have this experience and to open up CISP to this Latin American country. And thank you to my CIS mentors, Dr. Solomon, Dr. Chamberlain, and a special thank you to my Argentinian mentors, Paula Granda, Nadia Robles, Dr. Veronica Pese, Dr. Alejandro Di Sibio, Dr. Julia Ismael, and the entire breast cancer team. So thank you so much for your attention, and I'll take any questions.
Did I understand you to say, it was a very good presentation, did I understand you to say that when people were taking this online thing, that they could get help in real time? And does that require that somebody be manning or personing the help desk all the time?
Yes, so there's actually employees of the National Cancer Institute that are in the virtual campus. That's their job, to be in the virtual campus at all time. So if there was any technical issues, they could get help at any time, or they would contact someone, if I was there, myself, or the other people in the breast cancer team to assist in other questions. But this would only be during working hours of the office, of course. But they also had the opportunity to work on the training module on their own time. Thank you.